The importance of cancer prevention in the elderly. Cancer is one of the most dangerous and leading causes of death worldwide, especially among the elderly. According to medical research, the incidence of cancer tends to increase as people enter middle age and old age. As the body ages, the immune system weakens, and the body's cells lose their ability to repair themselves, which increases the risk of cancerous cell development. Although cancer in the elderly can be caused by various factors, including aging and genetics, the crucial point is that cancer prevention is entirely achievable through proper measures and a healthy lifestyle. Why is cancer prevention particularly important for the elderly? Simply put, older individuals are at a higher risk of developing cancer compared to other age groups. Once people reach the age of 60, their immune systems begin to decline, making it harder for the body to fight off diseases, including cancer. Additionally, older adults may have pre-existing health conditions or underlying diseases, which make them more vulnerable to dangerous illnesses. This makes early detection and prevention of cancer even more critical for the elderly, as it can significantly protect their health. Cancer prevention is not just about avoiding risk factors. It is also about adopting a comprehensive strategy that includes lifestyle changes, a balanced diet, regular physical activity, and routine health checkups. These measures not only help reduce the risk of cancer but also improve quality of life, extend lifespan, and allow the elderly to maintain good health. Diet plays a crucial role in cancer prevention. Studies have shown that a poor diet, high in fats, salt, and sugar, can increase the risk of developing cancer. On the other hand, consuming plenty of vegetables, fruits, fiber-rich foods, and vitamins can help the body fight cancer-causing agents. Furthermore, maintaining a healthy body weight is also vital, as obesity is a risk factor for several types of cancer. In addition, regular physical activity is essential for preventing cancer. Older adults often experience reduced mobility, leading to weight gain and chronic conditions such as high blood pressure, diabetes, and particularly cancer. Experts recommend that the elderly engage in at least 30 minutes of moderate exercise 5 days a week. Simple activities such as walking, swimming, yoga, or light stretching can be very effective. Exercise also helps maintain a healthy weight, reduce stress, and improve overall cardiovascular health, all of which contribute to cancer prevention. Another critical factor in cancer prevention for the elderly is routine health checkups. Early detection of cancer through screening tests is essential. This allows doctors to identify potential issues early and take timely action, improving survival rates. In conclusion, cancer prevention in the elderly is not an overly complicated task, but it requires patience and determination. Maintaining a healthy lifestyle, balanced diet, regular physical activity, and regular health checkups can significantly reduce the risk of cancer and enhance the quality of life for the elderly. These preventive measures are the key to living a healthy, confident, and long life. Risk factors for cancer in the elderly. As people age, the likelihood of developing various health conditions, including cancer, increases significantly. The elderly population, typically defined as those over the age of 60, is particularly vulnerable to cancer for several reasons, ranging from genetic predispositions to lifestyle choices and environmental exposures. Understanding the risk factors for cancer in older adults is crucial in devising strategies for prevention and early detection. In this section, we will explore the primary risk factors for cancer in the elderly. 1. Age-related factors. Age itself is one of the most significant risk factors for cancer. As we age, our body's ability to repair damaged cells diminishes, and the immune system weakens. This allows abnormal cells to grow and become cancerous more easily. The risk of developing cancer increases significantly as individuals reach their 60s and 70s, with the majority of cancers diagnosed in older adults. According to the American Cancer Society, nearly 60% of all cancers are diagnosed in people aged 65 or older. This can be attributed to the accumulation of genetic mutations over time, which may lead to the development of cancer. Furthermore, the body's natural mechanisms for detecting and repairing DNA damage become less efficient as we age. 2. Genetic factors in family history. Genetics play an important role in the development of many cancers. Family history can be a crucial indicator of cancer risk, as certain types of cancer tend to run in families. For instance, individuals with a family history of breast, ovarian, colorectal, or prostate cancer are at a higher risk of developing these cancers themselves. Inherited mutations in genes such as BRCA1, BRCA2, or APC can significantly increase an individual's risk of developing specific types of cancer. However, it is important to note that while genetic predisposition can increase the risk, lifestyle factors and environmental exposures still play a significant role in cancer development. Not all individuals with a family history of cancer will develop it, and conversely, some individuals without a family history may still be diagnosed with cancer due to other risk factors. 3. Weakened immune system. As we age, our immune system becomes less efficient at detecting and eliminating abnormal cells, including cancer cells. This decreased immune function is partly due to the natural aging process, where the production of immune cells declines, and the immune system's response to infections and abnormal cell growth becomes slower. In addition, certain medical conditions that become more common with age, such as autoimmune diseases, chronic inflammation, and organ dysfunction, can further weaken the immune system, making older adults more susceptible to cancer. Furthermore, treatments such as chemotherapy, radiation therapy, or immunosuppressive drugs prescribed for other conditions can also compromise the immune system, further increasing the risk of cancer in elderly individuals. 4. Lifestyle factors. Dietary habits and obesity. Poor dietary choices are significant contributors to cancer risk in the elderly. Diets high in processed foods, red meats, and unhealthy fats have been linked to an increased risk of cancers such as colorectal, breast, and prostate cancer. On the other hand, diets rich in fruits, vegetables, and fiber are known to have protective effects against certain cancers. Obesity is another lifestyle factor that significantly increases the risk of cancer in older adults. Obesity is linked to a higher risk of several cancers, including breast, colon, esophagus, kidney, and pancreas cancers. Excess body fat can produce inflammatory molecules and hormones such as estrogen, which can promote the growth of cancer cells. Additionally, obesity is often associated with conditions like diabetes and high blood pressure, which can further increase the risk of cancer. Physical inactivity. Physical activity is crucial for maintaining overall health, and its role in cancer prevention cannot be overstated. Physical inactivity has been shown to increase the risk of developing several types of cancer, including colon, breast, and endometrial cancers. Exercise helps to maintain a healthy weight, reduces inflammation, improves immune function, and promotes proper circulation, all of which contribute to reducing cancer risk. For older adults, regular exercise can significantly improve overall well-being, boost the immune system, and lower the likelihood of developing cancer. 5. Tobacco use. Tobacco use is the leading preventable cause of cancer, and this risk factor remains significant in the elderly population. Smoking is strongly linked to lung cancer, as well as cancers of the mouth, throat, pancreas, bladder, kidneys, and cervix. Although many older adults may have quit smoking in earlier years, the damage caused by years of tobacco use can persist long after quitting. Even former smokers remain at a higher risk for these cancers compared to non-smokers. For older adults who have never smoked, exposure to secondhand smoke can also increase the risk of cancer, particularly lung cancer. The risk of cancer related to tobacco use may continue to increase as individuals age, making it critical for older adults to avoid smoking or exposure to tobacco smoke. 6. Alcohol consumption. Excessive alcohol consumption is another lifestyle factor that significantly increases the risk of several types of cancer, including liver, mouth, throat, breast, and colon cancers. Alcohol can act as an irritant to the cells in various organs, leading to chronic inflammation and DNA damage. Additionally, alcohol can impair the body's ability to metabolize certain substances, making it harder for the body to detoxify harmful chemicals that may lead to cancer development. In elderly individuals, alcohol consumption may also be associated with other health conditions such as liver disease, cardiovascular disease, and cognitive decline. Reducing alcohol intake or abstaining entirely can help lower cancer risk and improve overall health. 7. Exposure to environmental carcinogens. Environmental exposures to carcinogens, substances that cause cancer, can significantly contribute to the development of cancer in the elderly. Over a lifetime, individuals may be exposed to various environmental carcinogens such as asbestos, radon, pesticides, and air pollution. Occupational exposures to harmful chemicals, such as those experienced by workers in construction, agriculture, and manufacturing, may also increase the risk of cancer. For older adults, the cumulative effect of long-term exposure to these carcinogens increases the likelihood of developing certain types of cancer, particularly lung cancer, mesothelioma, and skin cancer. Limiting exposure to these carcinogens and adopting protective measures, such as wearing proper protective equipment at work and reducing indoor air pollution, can help lower cancer risk. 8. Chronic inflammation and infection. Chronic inflammation plays a significant role in the development of cancer, as long-term inflammation can cause damage to healthy cells, increasing the likelihood of cancerous mutations. Conditions such as chronic inflammatory diseases, e.g., ulcerative colitis, Crohn's disease, or chronic hepatitis, can predispose elderly individuals to certain cancers, such as colorectal cancer or liver cancer. Infections can also increase cancer risk, especially in older adults with weakened immune systems. For example, chronic infections caused by viruses such as human papillomavirus, HPV, hepatitis B or C, or Helicobacter pylori bacteria are associated with an increased risk of cervical, liver, and stomach cancers, respectively. 9. Hormonal factors. Hormones play a significant role in cancer risk, particularly in cancers related to the reproductive system. For women, postmenopausal hormone replacement therapy (HRT) has been linked to an increased risk of breast and ovarian cancers. The prolonged exposure to estrogen in older women, particularly those who began menstruating early or entered menopause later, can contribute to hormone-sensitive cancers. For men, hormonal changes related to aging, such as increased levels of estrogen relative to testosterone, can contribute to prostate cancer risk. Monitoring hormone levels and seeking guidance from a healthcare professional about the potential risks of hormone replacement therapy can help mitigate cancer risks. 10. Other health conditions. Finally, certain chronic health conditions commonly found in older adults can increase cancer risk. Conditions such as diabetes, hypertension, and heart disease are often linked to a higher incidence of cancer. For example, diabetes and obesity, which often occur together, can increase the risk of pancreatic, liver, and breast cancers. Similarly, heart disease can be associated with an increased risk of colorectal cancer due to the shared risk factors such as poor diet, physical inactivity, and obesity. Furthermore, medical treatments for other conditions can contribute to cancer risk. For instance, treatments like chemotherapy, radiation therapy, and long-term use of immunosuppressive drugs can weaken the immune system and increase the likelihood of cancer developing. Conclusion. In summary, several factors contribute to the increased risk of cancer in the elderly population. Age, genetic predisposition, lifestyle choices, environmental exposures, and chronic health conditions all play a role in cancer development. While it may not be possible to eliminate all of these risk factors, awareness and proactive measures, including lifestyle changes, routine screenings, and early detection, can help reduce the risk and improve outcomes. Understanding the unique risk factors for cancer in the elderly is essential for implementing effective prevention strategies and ensuring that older adults can enjoy a longer, healthier life. Cancer prevention methods for the elderly. As people age, the risk of developing cancer increases. However, although it is impossible to entirely prevent cancer, older adults can take many measures to reduce the risk of developing the disease and enhance their quality of life. Cancer prevention methods not only help in reducing the risk of cancer, but also improve overall health and maintain a healthy lifestyle. In this section, we will explore various cancer prevention methods for the elderly, ranging from dietary changes, regular physical activity, health screenings, and reducing environmental risk factors. 1. Maintaining a healthy diet. Diet plays a crucial role in the development or prevention of cancer. Our eating habits can contribute to the growth or prevention of cancer, especially for older adults, as their bodies begin to weaken over time. Maintaining a balanced, nutritious diet will help reduce the risk of cancer and protect overall health. Increase the intake of fruits and vegetables. Fruits and vegetables are rich in vitamins, minerals, and antioxidants, which can protect cells from damage caused by free radicals. Antioxidants play a role in preventing the formation of cancer cells. Green leafy vegetables, berries like strawberries and blueberries, and nuts such as walnuts and almonds have high cancer-fighting properties. Particularly, vegetables like broccoli, kale, and bok choy contain compounds such as sulforaphane, which have been shown to reduce cancer cell development. Older adults should incorporate these foods into their daily meals for better health protection. B. Eat more fiber-rich foods. Fiber not only helps improve digestive function, but also reduces the risk of colon cancer. Fiber-rich foods such as whole grains, beans, vegetables, and fruits can help the body eliminate toxins and prevent the development of cancer cells. Older adults should increase their intake of whole grains like brown rice, oats, and barley to ensure an adequate fiber intake. C. Limit processed foods and high-fat foods. Studies have shown that consuming excessive processed foods, fried foods, and fast foods can increase the risk of several types of cancer, particularly colorectal cancer, breast cancer, and pancreatic cancer. These foods contain high levels of saturated fats, which can increase inflammation in the body, creating an environment that supports the growth of cancer cells. Older adults should limit their consumption of these foods and opt for fresh, minimally processed foods. D. Limit alcohol consumption. Drinking alcohol is linked to an increased risk of liver, breast, colorectal, and esophageal cancer. Especially in older adults, the health of the liver and kidneys begins to decline, and alcohol consumption can be even more harmful to the body. Studies have shown that reducing or eliminating alcohol intake can lower cancer risk and improve overall health. Therefore, older adults should limit alcohol consumption and opt for water, green tea, or fresh fruit juices instead. 2. Engage in regular physical activity. Exercise is a vital factor in maintaining health and preventing many diseases, including cancer. Physical activity helps maintain a healthy weight, improves immune function, and reduces inflammation, all of which contribute to lowering the risk of cancer. 8. Benefits of maintaining a healthy weight. Obesity is a significant risk factor for many types of cancer, particularly breast, colorectal, pancreatic, and kidney cancer. Maintaining a healthy weight not only reduces the risk of cancer, but also minimizes the risk of other chronic diseases such as diabetes and heart disease. Research shows that participating in physical activities such as brisk walking, swimming, or cycling for at least 150 minutes per week can help older adults maintain a healthy weight and reduce the risk of cancer. Exercise also helps improve the body's resilience and cardiovascular health. B. Improve immune function and reduce inflammation. One of the key benefits of exercise is improving immune function and reducing inflammation in the body. Chronic inflammation is a risk factor for cancer, and exercise helps reduce these inflammatory responses. Studies have shown that those who exercise regularly have a lower risk of developing cancers such as breast cancer, colorectal cancer, and lung cancer compared to those who are sedentary. C. Exercise is suitable for the elderly. Depending on each individual's health and ability, there are many types of exercises suitable for older adults. Gentle activities like walking, yoga, swimming, or tai chi help maintain flexibility, improve blood circulation, and reduce stress. Strength training exercises, such as lifting light weights or using resistance bands, are also beneficial in maintaining bone health and preventing osteoporosis, which is a common health issue among older adults. 3. Regular health checkups and cancer screenings. Regular health checkups and cancer screenings can help detect cancer at an early stage when it is more treatable. Older adults should participate in cancer screening programs that are appropriate for their age and risk factors. 8. Colorectal cancer screening. Colorectal cancer screening is one of the most important methods for detecting colon cancer. Tests like colonoscopy or fecal occult blood tests can help detect the presence of tumors or polyps before they turn into cancer. Adults over 50 years old should undergo colorectal cancer screening, according to their doctor's recommendations. B. Breast cancer screening. For women over 50, mammograms, X-ray of the breast, can help detect breast cancer at an early stage. It is recommended that women between 50 and 74 years old get mammograms every 1 to 2 years, especially those at high risk of developing breast cancer. C. Lung cancer screening. Lung cancer screening is especially important for older adults with a history of smoking or exposure to harmful substances. A CT scan can help detect lung cancer at an early stage when it can be treated more effectively. D. Cervical cancer screening. Older women should continue to have pap smears, cervical cell exams, to detect cervical cancer. This test is recommended every 3 to 5 years for women between 21 and 65 years old. 4. Reduce exposure to environmental carcinogens. The quality of air, living environment, and workplace can all impact cancer risk. Older adults should minimize exposure to environmental carcinogens such as tobacco smoke, hazardous chemicals, air pollution, and radiation. Avoid smoking and secondhand smoke. As mentioned earlier, smoking is a major risk factor for cancer. Non-smokers should continue to avoid exposure to secondhand smoke. Those who have quit smoking should also avoid secondhand smoke exposure. B. Reduce exposure to hazardous chemicals. Jobs that involve exposure to hazardous chemicals such as asbestos, industrial solvents, and pesticides can increase the risk of cancer. Older adults should try to avoid contact with these substances, especially if they have worked in high-risk environments before. 5. Manage stress and maintain mental health. Stress and anxiety can have a negative impact on overall health, suppress the immune system, and increase cancer risk. Older adults should learn to manage stress through methods such as meditation, yoga, reading, engaging in social activities, or walking in nature. Maintaining a positive and optimistic mindset can improve life quality and help the body fight off diseases more effectively. Conclusion: the importance of preventing cancer in the elderly. Cancer, a complex and multifactorial disease, remains one of the leading causes of death worldwide. As life expectancy continues to increase, the population of older adults is growing steadily, and with it, the prevalence of age-related diseases, including cancer. Preventing cancer in elderly individuals is critical, not only to improve their quality of life, but also to reduce the burden on healthcare systems and families. The aging process itself increases the susceptibility to cancer. As people age, their immune system becomes less effective at detecting and destroying abnormal cells, which can lead to the development of tumors. Additionally, older adults are more likely to have accumulated exposure to cancer-causing agents over their lifetimes, such as tobacco smoke, radiation, and environmental toxins. Thus, addressing cancer prevention in the elderly requires both general strategies for health maintenance and specific interventions tailored to this age group's unique risks and needs. A major challenge in cancer prevention for the elderly is the underrecognition of cancer symptoms in this population. Many symptoms of cancer such as fatigue, weight loss, and pain are commonly associated with aging or other chronic diseases. This can lead to delays in diagnosis and treatment, worsening outcomes. Therefore, it is crucial for healthcare providers and caregivers to be vigilant in recognizing potential signs of cancer and encourage early screening. Furthermore, lifestyle factors play a significant role in cancer prevention. As the elderly are at increased risk due to the natural aging process, it becomes even more important to focus on preventive measures such as regular exercise, healthy eating, maintaining an appropriate body weight, and avoiding alcohol and tobacco use. Studies consistently show that a balanced diet rich in fruits, vegetables, and whole grains, coupled with regular physical activity, can reduce the risk of several types of cancer. In fact, maintaining a healthy lifestyle is one of the most effective ways to mitigate cancer risk. For example, physical activity has been shown to lower the risk of cancers such as breast, colon, and lung cancer. Exercise helps regulate weight, improves immune function, and can reduce inflammation in the body, all factors that contribute to a lower risk of developing cancer. Additionally, a healthy diet that limits processed foods and focuses on nutrient-dense options can help protect against the development of cancer. A diet rich in antioxidants, fiber, and healthy fats helps the body repair cell damage, regulate hormones, and reduce oxidative stress, which are all protective mechanisms against cancer. Screening and early detection are essential to cancer prevention in older adults. Routine screenings for cancers such as breast, colorectal, prostate, and cervical cancers can help detect the disease at an earlier, more treatable stage. However, the elderly population may face challenges with screening, including the risks associated with invasive procedures, and the potential for false positives. Thus, decisions regarding screening should be made on a case-by-case basis, taking into account the individual's overall health, life expectancy, and personal preferences. It is essential to have open discussions with healthcare providers about the benefits and risks of screening tests, as well as alternative options such as genetic testing or imaging. Moreover, managing chronic conditions such as diabetes, hypertension, and heart disease is a critical component of cancer prevention. These conditions not only impact overall health, but can also increase the risk of developing certain types of cancer. For example, individuals with diabetes may have an increased risk of liver, pancreatic, and endometrial cancers. Regular management of chronic diseases through medication, lifestyle changes, and medical checkups can help minimize the risk of developing cancer in the future. Another important aspect of cancer prevention for older adults is the reduction of exposure to carcinogens. The elderly may have accumulated decades of exposure to harmful substances such as tobacco smoke, UV radiation, and certain chemicals. While it is not possible to undo past exposures, reducing further risk by avoiding smoking, excessive sun exposure, and environmental toxins can significantly decrease the risk of developing cancer. For example, wearing sunscreen and protective clothing, quitting smoking, and reducing alcohol intake can prevent cancers of the skin, lungs, and liver. Psychosocial factors such as stress, depression, and social isolation should also be considered when discussing cancer prevention in the elderly. Studies have shown that chronic stress can weaken the immune system and increase the risk of cancer. It is important for older adults to engage in social activities, maintain strong relationships with family and friends, and seek mental health support when necessary. Social support has been shown to enhance emotional well-being and resilience, contributing to a better overall quality of life and a reduced risk of cancer. Finally, it is essential to understand that while prevention strategies can significantly reduce the risk of cancer, they cannot guarantee that cancer will never develop. Even with the best preventive measures, some individuals may still develop cancer due to genetic factors, environmental exposures, or other unpredictable causes. Therefore, it is important for the elderly to be proactive in their healthcare, attend regular checkups, and discuss any new symptoms or concerns with their healthcare providers. Early detection, combined with modern treatment options, offers the best chance for positive outcomes in cancer treatment. In conclusion, preventing cancer in the elderly involves a multifaceted approach that includes lifestyle modifications, early detection, management of chronic conditions, and the reduction of carcinogenic exposures. With aging comes an increased risk of cancer, but with the right preventive measures, it is possible to significantly reduce that risk. Both healthcare professionals and caregivers play a critical role in educating older adults about cancer prevention strategies and ensuring that they have access to the necessary resources and screenings. As life expectancy continues to rise, focusing on cancer prevention in the elderly will become even more crucial in ensuring that older adults lead healthy, fulfilling lives free from the burdens of cancer.